before you know it, 2017 is going to be here. Not enough time. Managing your time is a heavy load. Haven't started your New Year's resolutions or need some help in keeping them going? Help is here. Smart Health is back and here to help you with everything from sleeping, drinking water and exercising, to saving for retirement, volunteering, or telling someone you're grateful. Smart Health is the state's voluntary wellness program for eligible members of the Public Employees Benefits Board subscribers. The website has interactive tools that will help you focus on your health and well-being and earn a $125 incentive for 2017. Earn 2,000 points by September 30th, 2016, and get either $125 off of your PEP medical plan deductible or a one-time deposit into your health savings account. Easy, easy, easy to get the points completed. Take your assessment, 800 points. Governor's Early Bird bonus by March 31st, another 100. Watch a video on how to navigate the site, 200 points. Connect your device, Fitbit, smartphone, 100 points. 1,200 points. You're over halfway there. Super easy. And then I mentioned that our agency director has given permission for our employees to take the assessment at work and de minimis use for tracking their points. And then I said, need Smart Health help? We have a link on the home page of Inside HCA under events. Our wellness page has it, where they can contact me.
Excellent. Well, thank you.
So there you go. That's an idea.
That was actually a surprise.
Yeah, good surprise.
Share that notice with us.
Yes.
Okay.
Good, and good prop.
Good,
Thank you.
excellent prop.
I gotta go hang on the wall again.
We have a series of clocks that are not connected to each other, which is really fun. It's like you can be late for one meeting and early for another, and you never know what time it is. I think what Christy said brings up something really, really important, and that's we have seen very strongly that senior leadership involvement really leads to higher participation amongst your fellow workers. So any way that we can help you work with your senior leaders, that would be great. And coming out in around the end of February will be the first time that we've reported out well-being assessment results to agencies. And you will get a report if you have, well, all of you have more than 50 employees. If you have more than 50% or more completion rate of the well-being assessment, or if you are big enough that you have 1,000 completions, even if it's not 50%. And to protect personal information, any question that has fewer than 20 responses won't be reported to you. So that means you can't track back to say, well, we have 10 people and 9 of them said yes and 1 said no, I know who it was. You can't do that kind of thinking. So it's a protection of PHI. So we'll do more about that later. I think Christy brought up a really good thing, and that's that we have a website, and Ron is going to take us through it in our very first session today. It's Ron has done a great, it's a team effort, but Ron is our lead for this, and I think the website's really, really become useful. Secondly, the Washington Wellness Conference, which is the day before the Healthy Worksite Summit, is just an excellent value. It's a good use of your time. The Washington Wellness Conference is a full day. It's free. Well, let's say it's no cost to you. Nothing's free, but it's no cost to you, and a full day. And then for those of you that applied for scholarships, we're nearing being able to fill them all. We currently have 68 people signed up for the Washington Wellness Conference and 59 applications for the scholarships. So we'll do more about that. The Smart Health Worksite Wellness Roadmap. That we used to call them standards or criteria. What we've really, by listening to you, what we've really changed to is a steps. What the things that you can do to really evidence-based to really create an effective wellness program. And the more of them you get in place, the more likely it is that you'll really have some impact in your program, both in reach, how many people you reach within your organization, and then impact, did people change? And that's really the value that you can produce. And then from DOH, we have, and the American Cancer Society, we have a look at improving colon cancer screening rates. It's an exciting topic, one that we all think about constantly. And we know
for the lead.
Yeah. What we do know is it is a screening that really needs to be increased in the appropriate people getting it. Mammograms do pretty well, pap smears pretty well. Colon cancer screening rates are pretty low nationally and in our state and amongst Fed employees. So they bring to us an approach to help with that really valuable screening, and then networking time. So let's start with Ron and ask questions as we go, but we will try to keep to our timeline.
Yeah, and for those of you on the webinar, you should be able to access our agenda through the handout tab. So feel free to pull that up as I switch screens right now. We made these web changes based on your feedback, and this is really just for you, and so we need your input to keep making it better, trying to make it better. So feel free to share your thoughts and ideas, and we'll do our best to try to incorporate those changes, okay? And I'm going to walk through really quickly 5 of the bigger changes, and we'll touch on a couple other ones later on today. So the first big change is we updated this left navigation here. For those of you who have been around for a while, it just looked a lot different. We kind of had them chunked apart. We just moved away from that. We just went with the single navigation on the left-hand side to hopefully match our new program needs. So that's the first change. The second change is some of you might have noticed that Team Workwell isn't anywhere on our website anymore, and that's intentional. Instead of asking you to fill out an application to join Team Workwell, we're now taking the approach that you're all just part of our team, just up front from the beginning, and that we're just here to help you right from the start. So we want to just take down that barrier and also reduce the confusion around all these different brands we have. We have Smart Health, we have what was formerly Not Me. There's some changes with that. Team Workwell. We had a lot of different names. We thought, okay, we'll just drop that one, make it a little bit easier. So for those of you who might be wondering about that, it's not a mistake. It's going away. Third change. There's this tab right here called Tools and Resources now. And actually what we ended up doing, we combined 2 separate previous sections. It was Promote Employee Health and Tools and Ideas. And the thought behind it was, why not just point you to one spot to try to find resources that focus on the different dimensions of wellness and trying to weave in and add tools that you can use at the work site. This is definitely still a work in progress. Some of you have some ideas on how to add some rich content to this. We're all ears, but I know that we've touched just a couple of these and really trying to craft like a web conversation for, put yourself in the place of a brand new coordinator who's working with us, what we're trying to relay and what you can actually get from these sections here. The next change is Find a Wellness Coordinator. And what we ended up doing here is with my groups coming on board, so far we have 64 new public employers added to this list, hoping to get more. We decided to do these kind of collapsible lists. So it's basically, it works the same, it just looks a little bit differently. So you just literally need to click the tab, open it up. You can find colleagues that you want to reach out to and connect with. When you need to make updates with any changes, send those new coordinator contact information to us. We'll get them updated here. But those are the differences there. And what we try to do to help is right here in this blue alert box, we try to call out, hey, if you're in the higher education group, contact Pam for assistance. Just to try to make it easier so you don't have to guess so much, especially for someone who's new, who to connect with. So that's really the gist of the changes. Is there any questions about that? Anything right now? Okay, so I'm going to actually go to our next change and then hand it over to my colleague, and that's our Attend Our Conference page. Last year we didn't have anything about our conference before, and we have this here for you now.
Okay. Hello, everyone. Some familiar faces and new faces, which is great. And lots of participation via webinar. That's great. So needless to say, we're pretty jazzed about this coming conference. We're calling it our Washington Wellness Conference, about the speakers, and also as we have sent out to you that just an unprecedented number of folks interested in attending. Actually, I got numbers right before I came in here, hot off the press, and it's actually up to 76 now, 67 of which have applied for scholarships. And as you know, we're going to wait till, give it until January 29th. We very much wanted to prioritize coordinators, followed by team members, wellness team members, receiving those. So shortly after the 29th of January, of course, we will, again, based on wellness coordinators as priority, award the additional scholarships that are remaining, look at what's left, and of course do our very best to finish awarding those and extending that in the most equitable and evenly way possible across the organizations. Our goal is truly to get representation from as many organizations as we can at the conference, specific to our key audiences, such as yourselves. So, but on the web page, I'm just going to kind of give you a brief overview and touch on some things. It kind of tells you the what, who, where, when, how, tied to the conference. And as I'm sure you know, it's again at the Linwood Convention Center, and we of course are continuing to collaborate with the Association of Washington Cities, graciously allowing us to piggyback their event, their annual conference. And they have an excellent agenda as well this year, which I'm sure some of you have taken a look at that at their site. And then they also have a block of rooms, and that's I believe it's Seattle Courtside, but again, that's on their site as well, and there's a deadline tied to that. So if that's something that you're interested in, just a heads up, check into that as soon as you can. So those kind of details, housekeeping, logistics, are all there on the website for you. And also, get my notes here when I wanted to focus. Okay. I actually wanted to stress that, there's three different ways that you can attend the scenario of conferences this year. Of course, you can, as Scott indicated, folks can attend the Washington Wellness Free Conference that we're hosting on the 23rd of March. And we really want to stress that even those that are applying for a scholarship application, and if we're not able to extend those to everyone, and it looks like we won't be able to because we only have 60 and we're now at 67 requesting them, that just really stressing and promoting, of course, that they, of course, can attend the Washington Wellness Conference for no fee. And we'd very much like, again, as many of your team members, your wellness team members there as possible. That's really important to us as well. So that can attend that, just that, or I had a couple of folks from my group last year weren't available for the pre-conference, so attended the Healthy Worksite Summit Day. One that received an actual scholarship, and one whose budget allowed her to pay for it and attend it. So that's a scenario as well. And then, of course, the last one, attending both. So, but regardless of the event that you're applying for, striving for, attending, that we have a bit of a task to do, and it's on the website, the webpage for the Attend the Conference. And regardless of what you're hoping to attend, we need you to complete our registration form. And on there, it, of course, as you might already know, it indicates if you're also interested in receiving a scholarship. And then you send that to us, and then we will contact everyone that has submitted these applications to us, and either announce that they are a scholarship recipient, or if we weren't able to extend that to them, however, we hope to see them at the Washington Wellness Conference, or, etc. So we will reach out to everyone that submits a registration and or scholarship request. And then regardless, again, of which scenario planning to attend, you will need to go to the Healthy Worksite Summit after we connect with you and or your team members. We'll have those directions in the message as well, that's going to the Healthy Worksite Summit and registering there for whatever event scenario you're planning to attend. So that's just really important, those record keeping and logistics and registration process.
Pam?
Yes.
I registered for it, and I believe my agency's paid, but I don't know that we've gotten anything back after the payment. I got the initial registration, you're registered, but I don't know that we got anything back saying after it was paid that it's,
Okay.
when we get that.
Could we connect maybe during networking? Because I wanted to extend to you folks, we have time allowed, and if there's, specific questions and ways that I can follow up and help, find out some things for you, I'd like to do that very much so. Yeah, so you know what's going on and where the status is. So, then of course, our speakers. Has everyone had a chance to peruse the agenda? Who's going to be there and such? Okay. We're pretty excited about it. Laura Putnam, actually Erin and I had attended the National Wellness Institute conference this past summer in Minnesota, and we had the opportunity to attend a 3-day workshop, Worksite Wellness Track workshop, and Laura Putnam was one of the main facilitators. She's recently wrote a book called, Worksite Wellness That Works, and she was incredible. She's very upbeat and dynamic. She's done a lot of research with various companies and organizations to really try and find some common themes that really play a key role in developing and implementing an effective worksite wellness program. She's real excited to join us in the Southwest because I believe she's from the Seattle area. And as a result, she gave us a heck of a deal. She said, oh boy, I'll be in my home territory. I'd love to be there. And she might even have an additional surprise for us when she gives her presentation. So we'll see what comes of that. And then Dominique Munafo, am I pronouncing his last name? Okay. Scott had the pleasure of seeing him speak. He speaks as a Chief Medical Officer for Optisum and is an expert in the sleep field and its impact on productivity in the workforce, etc. So he will talk to us about that on our conference day. And then we will have a Smart Health, more like of a workshop. We'll have a couple folks from Limeade come in and do kind of interactive workshop with us so that we can hopefully identify this as an even more valuable resource and how we can utilize it to meet our worksite wellness goals. And then lastly, Tom Emmerich, and he has written a couple of pieces, and one's tied to personal health, and he is also co-authored pieces tied to cost and benefits, and worked with a lot of various companies and organizations through the years. He's, president of his own consulting firm, and he's really upbeat and dynamic as well. So anyway, putting a plug in for all that we hope to bring and we plan to bring to you folks that day.
Yeah, so
yes.
We've seen the well-being assessment results across all of Tabnall Smart Health. And it's very interesting that the top 4 risk areas, and they're consistent through most of the agencies, is number 1 is not a surprise, it's weight management. Number 2 is back health, which is really not a surprise because for years it's been often the number 1 reason that an adult visits a primary care physician. Number 3 is sleep. This is not specific to sleepy state employees. This is a national issue that's being recognized, and the research has been around but is really growing. What to do about it is coming online, but is still starting. So I think I actually have heard Dominic speak twice, and he'll keep you awake, and it's a very interesting talk, and I think it will really bring to your attention that the issue of sleep. And then the 4th risk factor that we're seeing consistently is lack of physical activity. So weight management, back health, sleep, and physical activity will very likely be your top 4. That's pretty consistent.
Along, if I can segue, and if you, I know I've seen some research and heard some reporting out on how those top 4 are so interactive and have associations and cause and effects. Sleep, for example, they're looking at its contribution to the obesity epidemic when people struggle with sleep. So it's, you know, in the business of wellness, there's not always real clear, you know, discrete boundaries as far as the impact you can have. That can be a real positive because, you know, looking beyond the obvious and helping you design your programs and the activities you bring to your staff and faculty throughout the state as far as, you know, how can it overlap into other areas as well in addition to your primary focus.
And Tamara, you're going to go over the agenda for the Healthy Worksite Summit?
Yeah, well, can we get to that site then?
No, I mean, you don't have to right now, but I was just going to give a plug for the Healthy Worksite Summit. I've been involved with that for years, and I have an opportunity, since it's my field, to go to conferences nationally, which, you know how conferences are. Sometimes they're good, sometimes they're not. And Healthy Worksite Summit is consistently an excellent conference. So even if you don't get a scholarship, $125 is an amazingly low price, and it's located close. So if you can get there, I really encourage you to. I think that for your role as a wellness coordinator, it'll be well worth your time and your agency's money.
Yes. And after March 5th, it increases to $150, which is still a very nice value. So for what you're receiving, I know alone the keynote, I'm really jazzed about hearing. Are any of you familiar with the Blue Zones? And yeah, and I believe, Ron, you read his book, did you not? Or, yeah. So really fascinating perspective on health and worksite wellness and, you know, staying healthy and what it takes to do that. Works with different organizations and businesses and such. So that should be interesting. And then they have a nice variety, as always, of breakout sessions. And I know 2 or 3 really have stuck out for me. So refresh my memory. But
when will we know about the scholarship so we can register for this?
Pardon me?
We don't want to register for this unless we find out if we have a scholarship
Yes.
or not, or if we're going to pay for it.
Exactly.
So when would we find that
You
out?
will find that out very shortly after January 29th, possibly even the day of, because I will really want to get this squared away for you folks as soon as possible. Okay? And we'll give you, if you do receive a scholarship, you'll be given a code, and then you just place that code. It's pretty user-friendly, the registration site. And then that will just zero out a balance for you, and you'll be registered. You need to register for the Healthy Worksite Summit as well. There was a little bit of early on, with our partners, Association of Washington Cities, on whether or not they would need that. And, you know, as far as registering for just ours on their site, they are asking us. I confirmed that, again, just to make sure. So regardless of whether or not you received a scholarship, again, we'll contact you, share your status, and guide you accordingly. And we'll provide a link right there in an email for you where to go to register. Are there any other questions?
I don't have a question, but I was going to comment. Last year I went to this the summit, and it was the best conference I've ever been to.
Oh.
So, and I've been to a lot of conferences. So I was quite impressed with the speakers, with the breakout sessions. I mean, it was the best I've ever been to.
Oh, wow.
Yeah.
Boy.
So I'm looking forward to this year.
Boy, we've got, I hope we
pop it.
I hope we cut the mustard for you this year. No, that's wonderful to hear. Thank you. I know from the evaluations and just unsolicited input, folks overall really seemed to enjoy the pre-conferencing conference last year, which was great. It was my second. This is our 3rd year, right, Scott, formally? So when I first started, I literally, the first week I came on board was the week before the conference. So I hit the ground running, and of course, Sonia, as we all know, is a taskmaster. I was kept on track for that. No, it was great, and so this is my 3rd year, and I feel like 3 is the charm, and I'm finally think, yeah, this is great. I can do this and make sure it runs smoothly and all that. So it's exciting. Yeah. Any other comments? Questions? Or well, we hope to see you all there, that's for sure. So, yeah. And just, even though, you know, there might seem like one last plug, a lot of time, just if you haven't registered yet, we just really urge you to do that, as well as your team members. You know, we still, you know, we keep having applications, registration forms coming through, and we want that to continue on. So, okay, thanks. So what's next, Jen?
All right,
Okay,
so thanks a
Ron
lot,
again.
Pam. Yeah, I'm gonna pick it up here with the Smart Health Worksite Wellness Roadmap, and this is somewhat new, but it's really old as well because it's really just an update to what we had before. And so there's several ways you can find it. We have here on the home page where to start. We say start with Build Your Wellness Program. You can also access it here. In terms of what this section of the web is the resources behind the roadmap. And so for those of you who are new, hopefully you can go here, find out a little bit about the what and the how. For those who have kind of been through this process before about reporting your progress and applying for your award, there's a few changes in place, and we'll go over some of them right now. And so reporting is typically due February 1st. What we're asking is that you send your completed Smart Health Worksite Wellness Roadmap with the related samples we asked for, and a copy of your wellness plan that covers the great work you did the previous year. And so if you haven't had a chance to see the new roadmap, here it is. And my colleague Erin is going to go over a little bit of the functionality later. But keep in mind that if you feel like you need more time making the transition, like you already started working on the previous version, and now we just kind of switched it up with this new one, contact your outreach support person, and we'll work with you to figure out how to transfer that information. We really want you to report your progress so we can stay connected to your work, and then ultimately offer you recognition for that hard work through our ZOAID Award. And so for those of you who don't know about that, you can go to our webpage that's titled Earn Our Award, and literally that'll like tell you a little bit about what the ZOAID is, what you get, and a few more details about it. But jumping back here to the Build Your Worksite Wellness Program, we updated the roadmap for three main reasons. One was to incorporate Smart Health. You know, that was new. We didn't have anything tied into that before. Two, we wanted to try to streamline the tasks. We hope we did that. We'll see how it goes for you. We're always looking for your input. And number three, we wanted to try to make it more clear and manageable. And so you can, again, let us know if that worked out. And so although we updated this document, we want you to know that we're still in transition. This is actually like a temporary stopgap. By next year, we actually hope to have the roadmap through an online application where you literally would come to our section of the website, fill out your contact information, kind of like log in essentially, and you would just track the checklist online. And so you wouldn't have to worry about, where did I save it? Where did I keep it? My hard copy, you can always just come back and do it. And it's going to really help us track year after year your progress and be able to report that out more effectively. So it's going to change again. So I want to give you a heads up on that, but change for the better. And we wanted to try to make this more approachable for all the groups we work with. Some of you have earned the ZOAID before. Maybe it seemed like it was fairly easy. I know some of our mature programs realistically do a lot more than the tasks that we outline here. And what we want to say is, that's great. We don't want you to stop and just feel like, oh, this is all I need to do. We're not saying you can't go beyond what's here. We just realize that there's some organizations that are just starting out, and we want to try to help them as well, figure out, what are the first steps, maybe some of the main best practices to start with, and then they can build from there. And so that's how we were trying to approach it. And so that's where we landed on this 8-step process here, which is just a spin on the 8 standards before, just try to walk somebody through. Yeah, and so many of the tasks that were on the previous version, we carried them over. And although you can use this as a checklist and it helps you keep track of your work, we really want you to focus on your wellness plan. And so I know after reviewing some of the ZO8 applications this year, some organizations submitted something like a wellness plan, others didn't. As a team, when we got together and updated this, we realized, that's probably the most important piece for us to really get a sense of what you did. And so for those of you who need help maybe figuring out what that could look like, reach out to us and we can figure out some of that. But it really is just similar to a project plan. And the idea is that it's going to help your team, your leadership and staff stay connected to where you're going, what worked well, what did not. And just as important, as you experience some maybe turnover on your wellness team or maybe even the wellness coordinator, that wellness plan is going to really help that new person transition and kind of pick up from where you left off. And so that's the idea. That's the idea of trying to make this sustainable so that anybody who's joining your team can really get an idea of what you're trying to do. So how we got to this latest version, I'm just going to quickly summarize some of the outreach we did. We sent a heads up to you back in July. We followed up with the survey asking for your input in August. We got over almost 30 of you to respond and give us some great feedback. And so we threw out an initial version. We used some of that great feedback to incorporate some improvements and added some features that Aaron's probably going to touch on pretty shortly. Some of the feedback really kind of focused on, this is great to see these lists of these tasks to do, but we need some resources to figure out, how to do this. Like what do I do with that? And we understand that. We actually were working on that at the same time. We didn't announce that at the time, but we were doing it behind the scenes. And so some of you have been with us before. You might have heard about a WorkWell handbook. And as a team, we came together and decided, rather than have this large handbook that's like over 100 pages and go back and touch it and redo it year after year, we decided, what, let's just make all our resources accessible on the web. And as you scroll down on this page, literally, you can go to each of these steps, and you will see each of the tasks laid out and maybe some various types of resources to help you figure out what to do there. On each of these pages, we really cover the what, why, and how of the step to help you navigate through these 8, because there's really no other way to find it other than this link right here. We added these breadcrumbs at the top of the page, so you can literally click on them to go back and forth. And then at the bottom, as you scroll through, you can just go back and forth from the previous to the next in terms of just cycling through that. And so you're going to find some links to some articles. You might find an actual sample of something, or it may be just like some ideas to give you some thoughts around how to complete the task. As I said before, we welcome your input. We want to try to make this nimble, and so we're hoping that this is going to help us make changes quickly. We know that some of these links might go down, and so we're hoping we can fix them quickly for you. If you notice one, just send us an email, let us know, and we'll try our best to make that happen. So I'm going to hand it over to Aaron right now, who's going to walk you through some of the functions of the roadmap and maybe even let you preview how some of these steps work. But again, I want to emphasize that the resources we offer here are by no means the only sources of information that's going to help you complete a task. We really just try to boil down to like 1 or 2, so it wasn't overwhelming, like throwing like 30 things at you to consider for this one task. So we just said, okay, here's a few to think about, and with a simple search, you might find something even better. And so our goal was to do the research on our end, give you some few options to look at, and go about it that way, because we understand you have a lot on your plate and you're strapped for time. All right, so.
Thanks, Ron. So how many people have used the old roadmap before? People have. Okay, and how many of you had a chance to see the new roadmap other than just seeing it here? Okay, great. What do you guys think of it?
Much easier.
Awesome. I love it. Anybody else? Much easier?
I like the bigger.
Okay. Any other comments on it? Nobody likes the old one? All right. So as Ron mentioned, the idea of our new roadmap was essentially to try to streamline the process and make it a lot easier for you guys to be able to apply for the ZO8 award. but also to streamline your wellness program and to make it more comprehensive. And we know as wellness coordinators, not all of you guys are full-time dedicated to doing wellness. Some of you guys are HR professionals and you're working on it part-time. And so there's a lot of tasks and a lot of things that you want to do, and you're looking at what other agencies are doing. And some people have some really robust, really comprehensive programs. Other people are just kind of getting off that, at the very beginning and really don't know what or have a lot to do and don't really understand exactly how to do the whole process. And so the idea that we were trying to do with the roadmap is to be able to kind of make it a one-size-fits-all, so that your beginning wellness coordinator can just kind of jump right into it, understand the concepts of how to actually create a wellness program and be able to run with it and let the wellness program grow. And that also we wanted to have that same form be able to go for your more comprehensive wellness programs, so they can use it and apply for it and still hopefully offer some things that will help them be able to grow as well. So when you take a look at the actual is the roadmap still okay? Okay. So when you take a look at the actual roadmap itself, the very beginning part of it just kind of highlights, earn the award. Just what are the things that you need to do to report and to apply for the Zoid award. We kind of got rid of the actual application process itself. Instead, what we're doing is we're saying, hey, this is the form to use to kind of fill out. Send that to us in February, and then what we're going to do is we're going to take a look at it, and if you guys meet the criteria that is on the form, then we're going to automatically assign you guys or offer you guys the Zoid award. So there's not like this application like what we had before, which is an added step that was kind of unnecessary. And we've also gone away from the semi-annual reports. We usually have like a progress report as well. We're no longer doing those. We'd rather you guys focus your time on doing actual wellness activities instead of having to fill out crazy forms and stuff that we have. So just one form once a year, send it to us so that we kind of have an idea of what you guys have accomplished in your previous years and where we can help you guys further grow your programs. So here's just some basic instructions about how to fill out the form. This isn't a very complicated form by any means, but just a couple things to kind of go through. One of the things that we've added to this particular form, and until this form gets actually integrated online so that you can actually save it like what Ron was talking about earlier, you can actually fill out this form as a PDF online, and you can save it as different versions if you would like to, so you can kind of see what you've made or what progress you've made throughout the years or throughout the year. So we've added a completed column here and made it a drop-down menu so that you can just simply click, yes, I've completed this task. No, I have not. Not applicable. And the reason why we have not applicable is there may be some of these tasks that are just not, your agency just isn't able to meet. Like some of them may not be able to access the Smart Health Dashboard just because of the size of the organization. And so we wanted to make it so that you didn't want you to have to say, no, I didn't do this. It was just like, this isn't really feasible for us to do this. It's not a task that we can actually accomplish. And then oftentimes what will happen is you'll see the progress of actually working on doing some of these tasks. You may not have necessarily completed it yet, and it may not necessarily be, no, I have never done this. And so we've added this in progress, and this is something that we got feedback from you guys when we asked about the roadmap earlier, or middle part of last year. And so these 4 things will kind of hopefully are the different options that you can choose in the column. We've also added a date. This is another feedback that we got from you guys, and this kind of helps guide you in terms of when you actually completed those tasks. So you can kind of go back to the previous year and be like, okay, so what happened during this time frame that prevented us from having to do this task? Or maybe for some of you guys who deal a lot with the legislative, if there was a long session, you could actually implement some of the things you wanted to. That could kind of help guide you in terms of what was going on. We are going to look into adding like a note or a comment feature to it. We're kind of afraid that it's going to make it too long. So if you guys have any suggestions as you're kind of going through here, if you think it would be beneficial to have like a comment section or a note section, then please reach out to us and let us know what your thoughts are about this so we can see about trying to make this more user-friendly for you guys. And then the tasks are very similar to the tasks that we had in the previous roadmap, except we kind of streamlined some of those tasks, got rid of some redundancies, and try to make them very clear for you guys to understand. Still, as we know, as you go through them, you may not necessarily quite understand exactly what they are. And so what I'd like to do is just kind of draw your attention to step 4. This is a really good example of where there seems to be a lot of confusion about what needs to get reported, what doesn't need to get reported. For your guys' convenience, we've quickly identified what should be reported by having a little asterisk. So you can see like on this one, 3.1, there's an asterisk. That's what we've actually we'd like you to actually send an example of to us. And so I think before we had a bunch of them that you needed to, and we found out that a lot of the things actually go in your wellness plan, and we would just like the copy of your wellness plan. But there are some additional things that we would like to see, and so you'll see those noted with an asterisk that's next to each of the tasks. In addition, there's a description of what the actual task is, which is very similar to how it was before, except previously we had this really exhaustive resource book, our Team Workable handbook. And so if you guys ever want to crash a party, you can just kind of get out that manual and show it to everybody, and everybody else will run away. But it was kind of a 100-plus page, extremely difficult to kind of go through and try to find the information that you're looking for. And so we decided to try to take some of those concepts and put that online to make it really easy for you guys. And so each of these tasks that are in the roadmap correlate to exactly what we have online. So for example, since we're looking at 4, you can take a look here, and it says 4.1 is review your wellness interest survey results. So for here, if you don't necessarily know how to do this, or you don't know what a wellness interest survey is, you can click on these links that we have in here. Each task, we try to find a resource for you for each task. If we're not able to find a resource for you, then we try to give you some explanation in terms of what it is that we're looking for. So you can click on the employee health surveys, which is done by the Center for Disease Control and Prevention, and they will describe in more detail exactly what those look like. 4.2, if you're finding ways to combine leadership needs with interest survey results, one of the things that we have that goes along with that is writing your objectives, what they call SMART objectives. Most of you guys have probably heard that before. If you don't know how to do that, there's a link here that will take you to the website to be able to show you exactly how that part needs to be done. So again, each one of these tasks all have some information to try to help you as you go through the roadmap to be able to figure out what actually is it that we're looking for. And if you're not sure on it, then provide you examples of some of the things that you can actually do to try to understand what happens. And if you're still unclear about it, which is fine, then definitely please reach out to your wellness coordinator. And we're here to try to help you guys succeed and grow your wellness program as much as possible. Any questions on the roadmap itself or the functionality of it? Does it look like it'll be a lot easier for those of you who are kind of comparing the old one, previous one? Yes. Okay.
Aaron, do you need, I forgot whether you guys need leadership signatures every year for letters. I mean,
we don't need them every year. No, just once we have a letter for showing that you have leadership support. If your leadership has, no, nothing. You're fine.
Maybe when it changes.
Yeah, well, I guess if it has changed, yeah, you can still continue to get by.
On step 4, actually what we did, Steve, is rather than have you get them to sign like a letter at the beginning, one thing at the very bottom, the last task for step 4, we actually thought, it's a key component to get leadership's eyes on the actual plan itself. And so maybe just seeing that, they were involved in that process. And what we did, we put it in 4.7. We try to make this as sequential as possible, but this one, it could happen at any point depending on how you flow in your organization, right? So some of them you might do it at the beginning, some at the end, but just as long as they're kind of involved in the process, that was the idea, just to get them to be on board with it.
Thank you. And may I ask about the date then, the entry of the date? It looks like you put it in at the time that you complete the field if you don't have a specific date. So if you have a continuing activity, that's really what you want. If I complete this form today, then it would be today's date.
Yeah, and the date field, it was a recommendation from one of you actually, and really that's just for your own reference. I'm working with our IT folks up there. We're not sure exactly how that'll work online or if it'll be carried over, but really that was just to help you, track it maybe year after year. When did we do this type of a thing? We're not too worried about when you did it. That's just for your own.
It's not required to send with the date field in for us, but it's more for you guys to use to try to help gauge in terms of how you guys are progressing and what has to change and not change. Great, thank you. Okay. And so the last item on here that I just want to pinpoint is the Nebraska Worksite Wellness Toolkit. They have some really good documentation on how to create a wellness plan. There's other resources out there that are really well. So if you guys are kind of unsure about how that actually works, definitely view their website. Like I said, it's put together very well. It's very clear. It's very concise. And it'll kind of guide you in terms of what to look for in terms of wellness plan. We also have examples of wellness plans in terms of other agencies have done. I know Kathy has a really good one. LNI has one. the AG's office has a good one. So if you guys would like to see kind of what another agency's wellness plan looks like, definitely feel free to reach out to that coordinator or you reach out to one of us and we'll be happy to help you guys with that as well. And then the other thing that I just want to quickly mention is that we also have, like what Ron mentioned, is we wanted to tie Smart Health into the worksite roadmap, and so that will be one of the other changes that you will see. And then speaking of the Smart Health, can I pick on you for a second, Kathy? So a lot of times we kind of want to get about success stories in terms of what's been happening and not happening and whether Smart Health is really working or not. And so Kathy, the wellness partner for DOT, would you like to explain kind of your success and what you have, what accomplishments you've made?
Well, I've been now for the last couple months. But really, I have been getting really involved in the, and the more I do, the more excited I get, the more involved I get in Smart Health activities. So we've been doing it in our agency, but I've been doing it on my own as well.
Can you talk up just a little bit louder?
Yeah. And so I'm still doing it on my own and, of course, through our activities. But I will have to say that I feel very good. I really am getting to know more about the Smart Health, what's out there, so that's been a plus for my work. And it's not only that, it's kind of given me some really good new ownership of my job. Amazingly, I always tended to kind of put everybody else out in front and do stuff, but it's been a really good experience. Smart Health this past year.
Great. That's good to hear. And so I just want to show you a quick video in terms of, and I just got this video not too long ago, and maybe Cynthia can kind of speak more to that, but, or I'm sorry, Angela can speak more to that, but.
Are you going to show it right now?
Yeah. Doug said, like, go ahead and show it. Do you want me to show it or no? Okay. So this is a video that LNI has put together that's going to go out to their state employees about Smart Health and how you're going to earn the $125 incentive. And let me just make sure the volume is going to work on here. For those of you who are listening on the webinar, hopefully you guys can hear this. I'm not sure if you'll be able to turn off, but we'll see.
Oh.
Oh no, what happened?
No idea.
Karen, shame on you.
I know, right? Okay, well, due to technical difficulties, we're not going to be able to see that. Yeah, that is interesting.
Maybe just try refreshing the page.
Yeah.
I didn't really want to share that.
I don't think it's coming up, right?
Well, that's better than deleting.
Oh, here we go.
Hi, Tricia. How will you spend the $125 you save with your 2000 Smart Health plan?
I'm going to buy a skateboard. The long time bills go fast. They'll run.
Nice. I'm going to buy a giant tarantula for my exotic pet collection.
I'm going to get an Arona 360 Dassu. She's going to look super fine.
I am going to buy a new pair of pants. Pants. Okay.
Sure. Why not? So, okay. Have you considered getting a Wellness 360 Dassu?
Great idea. I only have one Wellness 360 tattoo right now. However, I'm still going to get some pants.
We are all default at $125. That's the beauty of it. Why?
Word.
That was not humor.
So anyway, so a really cute video. Do you have any comments or anything to speak to that?
And how was LNI able to produce that? What did you do?
We have the software, so Animate.
What's it called?
It's called Go Animate. Yeah.
Animate.
And we have a web person that helps to help put together, but I'm sure you can figure it out.
Yeah, so they have the software? Yeah, they had a web person who you could get some time.
Well, we have a contracted web person that helps with our web page and this kind of stuff. But this did not take very long at all, like a very minimal effort. Any idea on the cost of the software? I don't think it's very much. I don't know, but I'm guessing
So this is where you could use your ability to contact somebody at L&I using the website and the list and the number you find, and then they could look that up and tell you. So that's how you can interact. For those of you who know Doug Spahn at L&I, I could almost see him saying those words. That's Doug Hewlett.
Yeah.
Are those mimicking people that you work with?
Yeah, like the guy who's doing is Director Joel.
Oh, okay.
Yeah, and yeah.
Can I ask a question about the success stories that you asked people with different? And
Right. Question about the success story.
what many did you get, and are you going to be sharing them somehow?
Betsy is going to answer that question, and the question is, could you repeat that?
Your question was, how many have we gotten and how are we going to use them, is what I'm hearing. We've received probably close to 20 of them. I've been trying to find a very simple media release so we can get permission from people who want to be able to share them. And very soon, probably within the next month, we will have gotten permission from different people, so we will at least know who's willing to share, and then we'll develop materials in partnership with those success story people. So yeah, we're really looking forward to that. We have some really great ones.
And because of the ability on the Limeade platform to target something from your agency only to your agency people, if you have a success story within your agency, it can be set up so that only the people in your agency see it, if you would like to do that. And that also goes to messaging that you want to send your people. Those, you know, how you create an agency-specific activity, that tile can be used for a success story. It can be used to message something that you want within your agency. So it's a lot of uses. It's specific for your use.
Okay, great. Any more questions on the roadmap that we can answer for you guys?
We have one. On
Sure.
the roadmap, are we attaching our work plan to that, or we're just saying that we created one?
You would
guys want
attach.
to see it, don't you?
We'd like to see your previous. Yeah.
Okay.
Your previous.
And it'll show us how to.
Could you repeat the question?
The question was, do you want us to actually send her or send us the work plan, or is that right?
Yeah. Do you want us to attach it
Or
to
attach it.
our roadmap? So is there a link that we'll click on and it'll say download here, or?
Well, no. So the roadmap, you would just save the roadmap as a PDF file currently, and then go ahead and fill it out. You can fill it out online, and then you can print it out, and then you can scan that as. And then you would just submit everything. You can scan everything as one big document, or you can send them as separate files. Whatever is going to be more convenient for you. Some of the agencies have sent us a CD. You can do that as well. Whatever is the most convenient. Okay. Any other questions?
I have a question about the date. So here we are. So the date says due February 1, but it doesn't include any of the Smart Health data that we're going to receive, because then we're going to receive that later in February, right? So in the future, are you thinking about adjusting the date so that you can include some of that Smart Health data?
May I answer that?
Yes.
Thank you. Yes, the question is, well-being assessment data this year is being received in, we're really hoping the end of February. And it's our first time through, so we actually have went through a number of format changes, and we're trying to make it so that it's really a great usable form. Limeade works mainly in the private sector, and we really think in the public sector that the reporting being done a little differently is helpful. So we're working on that. Two changes coming up next year. One, this year the financial qualification period ended June 30th. It will now end September 30th in 2016. Give people a little longer. And that would, again, was in response to our finance department saying, okay, we've got to handle about how many people are going to complete it. And we are going to work with Limeade then, since we'll have completed the template of how the data will be reported, and we're going to ask them to report that as soon after September 30th as possible. So we're negotiating with them right now. September 30th, end of the financial qualification time. How soon can you have those agency reports out? So it will be sooner than this year, which is the end of February.
Any other questions? Okay, so the next thing on our agenda is the 80% by 2018, and so I'd like to invite Cynthia, right?
Yes.
Yeah, Cynthia from the American Cancer Society. She'll be talking to you about this particular employer project and kind of how it relates to what you guys are doing and what you guys can try to do to help us meet this goal.
So will you push the button, or how will I advance my slide?
You can advance the slide.
Oh, I can do it right here.
Yeah.
Oh, good. Okay.
Need help.
Oh, good. Okay. This was good because my new Christmas present reminded me to stand up and stand. So I have to tell you, I am loving this thing. This is the iWatch, but the fit features are amazing on it. And I've just been using it, and I don't think my husband realized how it connected to the work that we're doing with the American Cancer Society and how this just fits so nicely, no pun intended. You know, with Scott's overwhelming endorsement about the wonderful topic of colorectal cancer screening, I had intended to do a snippet of Robin Williams' great skit about his colonoscopy. And I would encourage you, when you think about trying to do a lunch and learn or something like that, I'm looking at it and I'm going, I have to probably edit it because of some of the language that he uses, but it is a riot. And personal story aside, I have my first colonoscopy scheduled for January 29th, and I am going to watch it the night before, just so I can get myself all ready to go. A little bit of background about me, to kind of tell you that I feel like I'm speaking with obviously kindred spirits and people who are really dedicated to this work, is that my background was in, I have a K through 12 certification that is probably long expired, but I am a health educator. I had a K through 12 degree in teaching health education from Central. And from there, I kind of moved into a career where I evolved into corporate communications, employee communications, and then strategic planning and healthcare communications, and worked with, I think, was the genesis of what positions you now have as wellness coordinators. So my job was to really get in deep and talk about what were the causes and risks to organizations when they insure people. What are we going to do about having a healthier employee base? And how are we going to incent people to take advantage of things like workplace health assessments? So long story short, that led me around to a nonprofit career, and I worked very closely with a lot of people at the Healthcare Authority when I was leading a team in Skagit County of 30 in-person navigators where we enrolled people in healthcare for the first time during the first open enrollment period. So when an opportunity came about to look for how do I combine communications, health education, work with population health and behavior change, where can I go? And this beautiful job popped up with the American Cancer Society. And I always have to look at my business card because it's kind of a long-winded title. And it really is called State-Based Health Systems Manager. And I get to work with state-based agencies, organizations like you. So my biggest clients are like the Department of Health, large public health organizations. I work with commercial insurance companies, as well as those that are publicly funded and are part of the Apple Health system here in Washington State. And my overall objective is to partner with you to help do sustainable long-term changes that result in the better health of all the people that we serve. So long story short, that's how we're all connected. So when I came in and I found out about this program, I'm going, okay, colorectal cancer, what's going to be new and exciting about that? We had an opportunity to develop a program that got people really thinking, well, what can we do to make this more than just raising our hand and saying, okay, we're all going to get screened, or we're really committed to doing this, and I've got a signature, and we're going to push colorectal cancer screening. Well, we developed a program with our partners at Department of Health, and we said, you know what, we're going to take it a step further. Because as many of you have indicated, the key to your planning and the key to your success is executive buy-in and your leadership buy-in. So no better way to do this than challenge employers, particularly CEO levels on the for-profit side, and within your own agencies, your leadership team, to really put some hard facts and figures behind how are we going to address colorectal cancer screening rates this way, right?
Well, it's not actually working.
Oh, okay. I can talk it. But whatever, is it working now?
No. I'll go back here.
Okay. All right. Because what I wanted to share with you, first of all, is really kind of where the state is in terms of colorectal screening. This is what we're going to talk about. Why are we doing it? What is it? What's the challenge? What are some steps and some tools and resources that we can provide to you? And Jill is going to be my in-person aide and counterpart because I'm based in Seattle. But at any time you want to connect with us, we're available to you. So next one, please. Anyone can get colorectal cancer screening, and this is something that I had to look at because on March 25th, the American Cancer Society and the Department of Health are bringing together leaders across the state to address colorectal cancer screening in Washington. So I looked at where we were, and Washington is that colorectal cancer is the second most commonly diagnosed cancer and the second leading cause of death. The big thing to note here is that across the United States, that in the first number 2 is usually number 3. And if you look at breast cancer rates and colorectal cancer rates in the state of Washington, they're like this. Literally the difference between my 2 fingers. This is how important it is in Washington State. And Washington State overall has a higher cancer rate than a lot of states across the United States. You guys know all that. The real key here is that we can save lives. This is 90% curable if you get screened. But the reality is that a third of the people who are eligible, age eligible to get screened don't. And there's a lot of reasons why. 40% of cancers, Jill, can you hand me this lovely little, I don't have a really neat thing to hand out like the clock, but this is as done. Remember these from health class? Health education. If you get screened right now and they find one of these precancerous polyps, your likelihood of not getting cancer, or at least getting those out as a result of your colonoscopy, is more than 90%. They might watch you and see if things are going as planned, if they have to remove them. If they don't remove them, you're good. But if they get it here, and even if they get it in stage 1, your chances of survival are about 90%. If it gets to looking more like this, stage 3, likelihood of survival is 40% after 5 years. If it's here and it's gone to other organs, it's less than 14%. So it's a killer, and it doesn't need to be, is really the message. Next slide. 2,700 new cases in Washington State in 2015 and 990 deaths. The problem for most people is they get in there and it's usually here or here. And sometimes there are no symptoms. So how do we convince people to do this? I am the perfect example of not and avoiding this. I'm way past the age of when I should have started. I have great insurance coverage, but I'm kind of scared. And before I came to ACS, I thought, well, you know, my life is so busy with other things, I don't have time for screening. But when you come to ACS, you think you're going to get cancer everywhere. So within the last 4 weeks, I've gotten my mammogram, and now I've got my colonoscopy scheduled. You kind of have to really walk your talk if you work for ACS. But it's human nature. And you guys know this better than anybody. It's human nature that you're dealing with. It's people's fears, concerns, kind of the uncomfortable nature of the procedure itself. But the key to this is really about getting people in and making it as seamless as possible. And when you're planning this, have some fun with it. Because we've already got some ideas that I got some, I'll show you. So here's another really big thing that is very interesting among our state. If you have commercial insurance, as you guys do through PEB, or people who are insured through their company, colorectal cancer screening rates are 60%. If you receive insurance through Apple Health, 43%, a gap of 17%. And among ethnicities and vulnerable populations, the screening rates are really like between 37 and 44%. Really, really low. So if you can get people in, you have a chance to cut that 2,700 number down by 30%, and that's been proven, and that's the goal of 80 by 18, is to, if we make it, if we can get 80% of the population that's eligible to be screened by the year 2018, we can reduce incidence rates, and we can reduce deaths nationwide by 30%. Yes?
You're talking about screenings.
Yes.
What is the current best practice for that? Because I know there's HMOs that colonoscopy is not their first screening tool that is used.
Yes. There are several ways, and what a lot of federally qualified health centers are using right now, and options that even I got as a Boeing company employee, was they have something called the FOBT or FIT test. You can do it at home. It's a stool test, small sample, pack it up, send it off, and it will detect primarily blood in the stool. The issue that we have with some insurance companies, mostly, is that it's all in how the test is conducted. If you use a FIT test as your preventive screen, and your test is positive, and you have to go get a colonoscopy to get more information, your cost may not be free for that procedure.
Right, because you've already used your preventive.
Exactly. In the same vein, if I went in to get my colonoscopy and nothing happened, I am covered 100%. I had to call my insurance company to find out that if I went in under a preventive code and they did remove a polyp, would I still be covered 100% without any copay? And the answer was yes. There are loopholes in the federal law under the Affordable Care Act, and in some states like Oregon, our neighbor, they have closed the loophole to make coverage 100% so that if you go in at the same time and you have a test, and or if you have to go in as a follow-up, it will be covered.
May I make a suggestion?
Yes. Yeah.
Why don't we, Washington Wellness, since we sit right next to the people
yes.
Over in the office here, that can find the answer to that. We will ask Kaiser
yes.
and Group Health, or two HMOs, what they do about that.
Yes, exactly.
Group Health and the FOBT is the one that is.
Yes, and that's a strongly, we're seeing now that in some cases, it helps people at least get the test done, because some people are fearful of the invasiveness of the colonoscopy procedure. So one has to say, if I can get them here, that's a good thing, because at least they're being initially screened. The next hurdle is, what do we do if there's a positive? And we just did a really interesting health fair up in a remote part of Alaska, and they did FIT tests, FOBT, stool tests. And one of the results came back positive out of about 65 screenings that they did up there. So then the work became, how do we get that patient in for a colonoscopy? And this could be a whole other long topic, but we don't have time for that. So that is step number one. Find out what your insurance company covers.
One question. So the discrepancy there, the 17%,
yeah.
is that mostly due to the number or the type of people who are in the commercial insurance as opposed to Medicaid? Or why is there something with the health plan that's different?
It's not necessarily the health plans, it's just the differences between people who are covered in Medicaid, under Medicaid, and sometimes they just don't get screened. Even the 60% is not high, but when you look at a map that has the color coding that I'm sure many of you have seen, Washington is like a lime green, and then there's like a forest green, which is the top, which is like 70%, 70 to 72% screening rate. Washington's the next highest to the top, but still that's not very good because you're still looking at least 25% of your population that isn't getting screened. So it's a lot of things. It's a lot of people's behaviors, it's access, it's awareness, and working within the communities and provider communities to help people and remind people that it's time to get a test, and then to encourage options for testing, which has been proven to be successful. So good question. Yeah.
Are you going to talk about earlier testing periods for people with family history?
Obviously, if you have a family history, then you should go in before age 50. And this is the whole guidance that ACS provides not only for colorectal cancer, but also for breast cancer, in that when we increased the recommended age to 45, and then you had the other one just come out 2 days ago that said age 50, the point is that if you have any of those indicators, family history, and just a general sense that you want to get screened earlier because of those things, yes, you should.
Right, so our messaging has been that people should get it earlier for that.
Yes, it's absolutely right. You're absolutely right. Those are.
You don't need to worry about the test because I have that family history.
Okay.
That's easy.
Okay, next slide. Again, age 50 is the age when most screening starts. It almost always starts with this little guy. And you can pass this around. This is Shirley's house, so we can do that. So the little polyp right there. And if the polyps are removed and they're precancerous, that's a good thing. That's the warning. And once you get your colonoscopy, you don't have to get another one for 10 years. And then you have to go more often. Exactly right. Yeah. Yeah.
May I just say one thing? It would be really a good deal to find out what the average age of your employees is.
Yep.
What we know is that it's going down in the state, but the average age for several years up to this year, the average age of state employees was 49. So you're talking right at the age.
You're right at that point.
You're talking the right population.
Yes. Next one. This is another picture from a different view of what it looks like at varying degrees and stages. So this just gives you another anatomical shot of what it starts out as from the beginning and all the way through to stage 4. And at that level, this is not a good thing. I have a very good friend of mine who I worked with, who was a WIC counselor in Skagit County, was complaining of stomach pain, really bad stomach pain. Her friend and I convinced her to get in and get a colonoscopy scheduled. She was here. It spread to her liver, and 3 weeks later, I was holding her hand for her first chemo treatment. This is how scary it is. And it's just so preventable. Next one. Okay. 80 by 18, which I call it, it's the shorter version, was really started by a national initiative that was really with the American Cancer Society and the CDC, Departments of Health. And when they started this, I believe it was in 1996, they really looked at this and again said, it's preventable if we can just get people in the door, if we can just get them tested. So they came up with the goal of achieving an 80% nationwide screening rate of age eligible 50 plus by 2018. Do we really think we're going to make it? The answer would be no. However, the 80 by 18 employee program is really designed to get you started and well on the way. So if you have the data breakouts, which it sounds like you do, you know which employees are in that magic range, you can look at your screening rates and you can develop a strategy for growth year over year. So we'll talk about that in a minute. And I added this one because you and employers as a whole are really critical to making this happen. So I wanted you to be recognized. This program encourages Washington employers to help achieve colorectal cancer screening goals, wanting to work with you and partner with you as the American Cancer Society on ways that we can get the word out, and then move from a 64% screening rate, which is the national average, to 80%. But again, you know Washington. And you can even make it more detailed within your specific organization. Go ahead. So why reach out to you? Why is this important? Because each of you assumes and has a risk and a liability portion to what you do when you're insured. So here's costs. Pretty simple. 160 million Americans have health insurance through employee-based plans. And medical expenses, indirect and direct, related to cancer, look at the figures. Total cost, $216 billion. This is not colon cancer. This is all cancers. Next slide, which I think is even more poignant. When Kaiser comes in and talks to the state of Washington and reviews its claims for the year, when it reviews how many people it covered and for what, this is a really interesting statistic. 0.068% of people who are insured, like us, file cancer claims. That's not very many. But of those claims, 10% of all medical costs are driven. So typically when insurance companies come in and share their data, they say that we have issues with cancer, diabetes, heart disease. The top three are always almost all there. What you got from your data, healthy eating, weight, stress, back pain, all of those, three of those relate to the causes not only of cancer, but of heart disease and diabetes. So you all know this. Cancer is a leading cause of short and long-term disability, and that's 11.8% of all total claims. 10 to 38% of people who get cancer do not come back. That's a huge impact on your workforce. And we also know that there's higher levels of absenteeism for caregivers, resulting in reduced productivity. You see the figures, 52% for women, 34% among men. And lost productivity nationwide, $33.6 billion. So this is the cost burden of cancer. So this is why it's so important to focus on it, especially if it's the second leading, more diagnosed and leading cause of death. Next one. So what do we want you to do? It's almost identical to your process that you've outlined in how to build your plan. Accept your challenges, get your data, figure out what your baseline screening rates are, and in most companies, it will alarm you how low they are. It's usually around 46 to 49%. Sometimes a little higher, but on the average, it's about where it stands nationwide when you do the data.
Is that addressed in the Smart Health information?
It's not.
You can find a way. We'll work with you. That's one of the things Jill and I were talking about, is how can you get age eligible and figuring out maybe how we can get an assessment of how many people have had a screening from your providers. We can get that data. We should be able to do that.
So we can get points.
Maybe later, maybe next year. Yeah, that's a good idea. So you've got a toolbox that you're using overall, but we have some tools and things that you can use to help promote and make this a worthy discussion of a lunch and learn or something that you may want to do later. What you do when you sign up for the 80 by 18 program is that you agree to track your screening rates annually and then report out on them in June of every year. That's a part of the national program as well, because what we want to see is hopefully you're moving the needle, and you want to see that too. You want to see results. And then you want
employees to tell you that they've gone in and had their colon.
They should be able to tell you that.
You think so?
Really?
Not with the employees, but the percentage of employees.
Oh, the percentage. Your insurance providers can give you
No.
They can't.
They can't? They can't, well, they can't give you the names, but can't they tell you how many people have had a screening? Well, I just got a phone call from my insurance company, and they wanted to know if I had done my fit test.
Your insurance company can do that. Your
Yes.
employer cannot.
You're right. Thank you.
I mean,
Thank
we
you
can
for clearing
push
that.
all the information out, promote it, and do all this.
But you need to
now.
partner with your insurance companies, which is why you need to get your data. You're absolutely right. I'm sorry.
What I'll have to say is, we will very likely not be able to provide employer-by-employer data.
You maybe can you look at it as a as an aggregate?
All of PEP.
There you go.
Yes.
That's perfect.
All of PEP.
Yeah. And that's unique to your situation. So I think you've got the option.
Some people are going to be embarrassed. They don't want anybody to know. They're going to
No.
be real proud and talk about it.
To me, that.
What people know is that they know they're over 50, they're
Yes.
50 or above.
Yes.
And you get the information out and make it easy for them to think about it and make the decision.
Exactly.
Yes.
Give them the information.
Yes.
Your site has so much information. We always go there and use for We're Red and a lot of the other the smoking challenge.
Yes.
And all that. I mean, no sense in reinventing it. You
No.
can create a lot of it.
There's so much we have, and the WashingtonCancer.org site through the Department of Health also has all of these details about it, the 80 by 18 program. Next slide.
I have a question.
Yeah.
So when someone's over
Next
50,
one.
how often do they get? So it's every 5 years.
10
or
years if
every
they do a
10 years?
colonoscopy.
Okay.
For a fit test, a stool sample at home, that's annual.
Oh, okay.
Next one. That must have, oh, okay. Oh, I did a fancy thing. Okay, what's going to be on the website is the actual pledge form. Next one. Just click again. Then it's going to be information. So if Jill wants to work specifically with you within your organizations or agencies, she might ask for you to complete this information. I don't know what your process is going to be yet. Do you have one?
Well, I'm just getting into this role and taking on this project, and this is introducing y'all to the initiative, and so I'm working with HCA to put this into a framework for
There
a
you go.
project. And so this is great information. Y'all are going to be more aware of it, and then I'm going to be working more with Erin to kind of roll it out.
Roll it into your platform.
Yeah.
Okay, next one. And then we have a little bit of an enrollment questionnaire. This may or not be applicable to you because there might be some things that you already have as a state and state agencies, but this really applies to people who are enrolling, like I'm hopefully going to get Sound Transit participating in this. And they would complete something like this, and if they didn't have a workplace health assessment, we would help them with that as well. Okay, next one. Some things that we know that work: policy change, flex times for screening. I'm sure that you have these things all figured out within your state culture. Birthday card reminders are also really, really effective. You can work with your insurance companies. Sometimes insurance companies send them out. I get one every year on my birthday from my insurance company. Partner, again, with them. Talk about it at open enrollment, but Colorectal Cancer Awareness Month is March. So you've got a little time if you want to think about putting something together. We have seen great success with Lunch and Learns. You can do things like Dress in Blue Day. You got the Colorectal Cancer Awareness Month. We have great little pins that you can get. And next one, I think I'm getting the high five sign here. We have tools and resources all available on this website that specifically can get you to get posters. And I really want to talk to you about this one idea really quick. Next one. All right. Let's get behind colorectal cancer. This was something I thought about as an idea for a really cool workplace wellness campaign. You have people that you've got to have to buy off on your campaign, right? So could you imagine the backside of Governor Inslee going, I'm all in, I'm behind colorectal cancer screening, and having that poster somewhere? Or you could have Mike Kreidler's backside, or you could have Secretary Wyman's backside, or you could just have a team of people and say, we're behind colorectal cancer screening. Just an idea that you might want to have some fun with. But it's a way to get the conversation started. And it's a way to talk about healthy eating, things you can do to be better and healthier. But then when you're age appropriate, look at your options, see what kind of tests. You can tell them what kind of tests they can get, and then work it through how you want to do it. But even within your departments, I would think you could have some fun with this. Depending on fish and wildlife, you could do some interesting things. You could do some things with transportation, all kinds of neat things. Go ahead, last one. So here's contact information for Jill and me. And I'm going to be working with Jill closely on getting her what she needs. If you want to do things like do an inflatable colon, we can do that.
We do have that.
We do have it. It's pretty fun. You can actually walk through a colon that's about from here to here.
How do you get that?
Just call me and I can get it for you.
Can an agency do that? I remember somebody talking about it.
It's really through the Colon All-Stars, but we'll just ship it down to you. And you could do a walk through the colon day. I don't know. Whatever you want to do. Yeah, if you have a wellness fair. But point is, you know, have fun with it. Make it fun. It is, pardon? You know, I was looking at these really cool little stuffed things that look kind of like a funky toy, but they're a kind of like a puffy pillow colon thing. So you could raffle it. You could have some fun things with it. And I would think seriously, look at the Robin Williams video, because that'll just ease the tension right away from people. Yeah.
So you mentioned this is, we'll be working with
Jill.
state agency, Jill.
Yeah.
So I work with 43 higher education public institutions throughout the state, and I'm
Oh,
sure
my
that
mind's
they'll be
spinning with ideas.
Yeah, and many of them, okay, public state employees. Okay, yeah, we'll work with you.
That's great.
Because I have some staff and resources across the state of Washington. So we will wrap our arms around you and help you in any way we can.
If we could get a question about colorectal screening into the Smart Health assessment, that would certainly help get agency-specific data next year. Obviously, it's too late for this year, but, right?
Yeah, well, great idea.
PowerPoint somehow, or is that?
I will leave it, and then and you can use the PowerPoint because the numbers are recent and local.
Yeah. You guys will come and do a lunch and learn?
We can help you.
I'm available.
And Jill can help as well. We could coordinate it. Yeah, if you can combine a big one or do something, we can figure it out. I'm happy to help.
Yeah. We're in the process of trying to get together a support group for caregivers.
Yeah.
And that getting started, we have people getting something like that started.
Yes.
With the materials.
Yes, in fact, the state of Washington is doing some great work on survivorship, and there's really some wonderful things happening there, and Jill and I Jill's actually coming up to Seattle tomorrow to talk kind of about what we do with all of these things that are going on, and then how do we spread them through the agencies and organizations within the state.
There's a lot of great resources. I just moved from Austin, Texas, and I was the director of the control program there for I know, maybe eventually y'all will go away.
No, keep it.
But I spent 5 years as the director of the cancer control program there and learned a lot. So I bring a lot of experience and enthusiasm, and I will say that Washington's very different in a lot of good ways, and the screening rates are better here. So even though they're low, they're better than a lot of places.
Yeah,
so
yeah.
We're on the right track.
We're on the right track.
Yeah. I hope to make it
To get it started. Okay. Anything else I can answer while I'm here? But you will have my phone number and information. Jill knows how to find me if you need her. If you need to go work through her, that's perfectly fine. But we're here to help, and we have lots of great tools and resources and posters and all kinds of fun stuff. But it's up to your imaginations to figure out what you can do with it. It'll be fun. I look forward to it. Can you just keep that deck? Oh, I just came forward to you. Huh?
Well, thank you. It's a screening rate that we're worried about it, Pat. And statewide, it's something it's really a service. It's a service to those people you're serving in your agency to help remind them that this is a good thing to do. What we'll commit to is we'll track down with Kaiser and Group Health, if you have the FOBT test, is the colonoscopy still covered as preventive if it's positive. So we can find that out right away. What I encourage you, I want to thank you for coming and encourage you to use the website. There's a lot of good information. It's really easy to navigate now. So use it. And if you have feedback, contact your outreach person. The wellness conference, excellent. So really, if you can make one or both days, that would be so good. And the wellness roadmap is designed especially then for the folks who are just building their program to say, here's the things that really help make it effective. It's evidence-based, both from the literature and from our experience, and then the colon cancer piece is great. We have, on the website, be sure to look at the trainings. They're all on the website. And in February, it's February 22nd, and we are combining with Department of Health to do a joint venture in that. So look at the website and see what that means. We're done for today. I encourage you to talk with your outreach workers, to each other. Questions?
Who's going to have the PowerPoint that we can get that on training?
We'll send it to everybody.
That would be great. That would be great.
Everybody ready?
Did everyone sign in?
Yeah.
Make sure we have it on back.
So, Ron, can we just post that?
Yeah, I was going to say, we usually will just post that stuff on our meetings and trainings webpage under the materials column. So the question was where to find the PowerPoint,
And that will be
we'll
there
get it up
on,
there.
When would you say be on the button?
Hopefully sooner
In
than
an hour.
Okay, a day or two. Any other questions?
Can you just give me a brief update on what's going on with the NOT-ME diabetes prevention?
Right. Tell me what part do you want updated on?
The name change.
Name change?
Okay, so, but are we still doing, statewide efforts
Yes.
to?
So the pre-diabetes, which has been labeled not me by our vendor, they did that so that when they made phone calls, they can't say diabetes on the phone, so they labeled it not me. They're dropping that, and so they're taking that off of their promotional material. So we're going to drop that also and call it a pre-diabetes program. Yes, if you would like to have an event that has the A1C test and then a class afterward, contact both you and Aaron. We're absolutely continuing to do that. We're continuing to work with our vendor to make sure that they are the best vendor they can be. We know that they haven't always been, but we're working with them. And what we do know is that for people that have an A1C that falls in the pre-diabetes range, 90% of them sign up for and attend a first class. And we also know for those that attend a first class, about 75% are completing the entire service. An extremely high sign-up rate, an extremely high completion rate, so there must be value that people get out of that. So the answer is yes, we're doing it as we did before, and if you want to do one, yes.
Are you coordinating any of these events? Like for example, I know you had the semi or whatever. So are you doing those on behalf of all of us, or is it really up to us to coordinate with our own agencies and Capital Campus?
What we've found is that if the screening is at the place that the people work and the classes at the place people work, people go. And if it's somewhere else, if they even have to walk, it decreases significantly the participation. So we've done collaborative events, like at the building where there's a whole bunch in one building. That works well. They all work. It's still hard to put together. So the answer is we would prefer it if possible to do it at the work site, but if there's a reason to do it collaboratively, we're willing to work with you to do that.
I'd like to share something in that direction, and that is the Center for Disease Control and Prevention will be rolling out actually this year. I don't know the exact time frames. My initial understanding is it's a year-long campaign for diabetes awareness. It's a huge national campaign, and there's a contact that we have at Department of Health, and Erin and I have met with her once already. She gave us an overview. They're meeting real soon again with key players and stakeholders throughout the state, physicians, et cetera, and they're going to learn a lot more about it. And so I'm thinking, I know working with my group, that aligning and tapping into this great national campaign, there's going to, all media is going to be involved, you know, TV, you know, written, et cetera. It sounds pretty big, so to speak, and that's a wonderful opportunity to kind of align or piggyback with that, maybe, you know, as far as you know, promoting that again, that kind of national backup.
We'll let you know when that is coming out.
We'll keep you posted.
There's a new request form, right?
Is there a new request form?
Updated. It's on the web.
If you've seen it on the web, then there it is.
No, it's the same.
I thought it was kind of updated. Anyway.
So the request
It's been
form.
updated a couple times, but not real recently, so, yeah.
Well, again, I want to thank you, and I want you to spend a little time, if you can, and say hello to your outreach worker and say hi to each other. If you see somebody you don't know, get to know them. It's the sharing amongst you is